Hi guys, my name's Steve. I'm down here with Fitness HQ. I'm one of the tutor and assessors here. And today I'm going to be taking you through the Level 2 Skeletal system to help you with your revision. And it's also going to help you mapping onto your Anatomy and Physiology for sports massage as well. So the whole purpose of today is just help you do a little bit of revision before your exams. So we're going to get started. Aims and objectives, as you can see there, I'm not going to bore you through them, so we'll go straight on to the skeleton itself. Skeleton has over 200 bones, 206 to be exact, and as you can see from the diagram here, they're all sort of labelled into the major bones in the body. From the diagram, you can see that there's a lighter shaded section, and then there's a darker shaded section on there as well. So this middle section here, this core section, comprising of the cranium, so the skull, it can contain the ribs, the sternum, the spine. These are all of our protective bones, and we call these the axial skeleton. So there's all this central hub here, it's protecting all the internal organs, it's protecting the brain, the spinal cord, etc. Everything off of that branches off, that's where we come onto the appendicular skeleton. So as you can see from the clavicle, the shoulder blades, which is called the scapula, down through all of your limbs and your arms, the pelvis, and all your legs, your hands and your feet as well. You can see from the labels here, you've got all the different individual bones. So at any point you feel like you want to stop the video so you can have a little bit more of an in-depth look, by all means do so. Now with the bones, we can split them up. As you can see from the diagram, there's lots of different shapes, lots of different sizes, so we can split them up into different classifications. And as you can see from this table here, we've got 5 different classifications. Now the key thing to remember with bones generally is they're based on the shape, not the size. So it can be this big, it can be this big. It doesn't matter, it's all about how it sort of looks. So a long bone, as it says in the description, is generally longer than it is wide. A short bone generally tends to be as wide as it is long. We've got a flat bone, well, they're flat. Irregular bones generally don't have a set shape, so they tend to be very specific to what their role is. And then we finish off with the last one called a sesamoid bone, which is, you could almost say, seed-like in its shape, and it's generally a protective bone. So let's go through a couple of examples. Long bones, the longest bone in the body here, we've got the femur. And as you might be able to kind of guess already, things like your arms, they're going to be long bones, so we've got the humerus. We've got the leg bones as well, so we've got your fibula, not fibia, and tibia. Short bones, there's only a couple. So we've got carpals in your wrists, so I think carpals for cuffs. And we've got tarsals for toes, down by your ankle down here. Flat bones, a few here. A lot of people don't realise that the cranium is flat, generally because there's a bunch of bones fused together, one on top of the other. Or next to each other, should I say, rather than top of each other. We've got the scapula, which is your shoulder blade. We've got the sternum. We've got the top of the pelvis here, which is called the ilium, which it does mention there as well. Irregular bones, like I said, no set shape, so the sort of obvious one is vertebrae. We've got the calcaneus here as well, which is actually your heel bone. Obviously, there's a lot of new sort of names coming in here as well, so you'll find that quite often with the anatomy. Basically, everything is based around the Latin names, so you'll see some new words coming up. And if you didn't already know, the patella is your kneecap, so that's just sesamoid, it's the only one. So as long as we're happy with that, we can move on. And we're going to look at generally long bones, as these are the most common ones that we find in the body. So this is what it looks like. So we've got the structure of a long bone. The actual shaft of the bone is called the diaphysis. So again, new words come up there. You can see it on the board anyway. The two ends, we've got the epiphysis. And if we take the humerus, for example, we've got the proximal, which means closer to the sort of midline epiphysis. And we've got the distal epiphysis, which is the one that's sort of further away from the sort of midline of the body. On the diagram as well, you can see this word periosteum. Periosteum generally is the sort of outer skin, you could say, of the bone. It helps with like transportation of nutrients and blood cells and things like that in and out of the bone. inside the bone, you might already know this, but we've got the medullary cavity. So a cavity meaning there's a hole in the bone. And inside that cavity is where we've got all of our red and yellow bone marrow. Red marrow in particular, really good for, not really good, it does produce red and white blood cells, which I'm sure you're familiar with. Red blood cells obviously for oxygen transportation, and white blood cells for fighting against infection. Now, surrounding the ends of each bone, we've got the articular hyaline cartilage. So if you imagine there's two bones, one on top of the other like so, the cartilage basically helps resistance against bones rubbing against bones, so it helps to sort of protect the ends of the bones a little bit. And you can sort of see a layout here of the bone. Now the end is very different looking towards the middle of the bone. As you can see, the middle is very rigid, we call that compact bone, whereas the ends is very porous. And the reason why the ends are porous, because if you're stomping down on the bones like so, it almost acts as like a little bit of a shock absorber. So the little gaps in the bone help to just resist the shock that we get from impacts of sports. Now the end of the bone, you'll see the word spongy. You might have heard of that if you've done sort of level 2 before, or you've done it at GCSE. But the technical name is the cancellous bone. So compact and cancellous bone. Now the way a bone is formed generally is through two different protein cells that we have in the body, and as you can see here, the actual technical term for bone growth or bone formation is called ossification. Now let's say we've got a bone like so, and please excuse my drawings. What happens is as a bone grows, these two cells sort of take away old bone and replenish with new bone. So imagine your bone as a house, for example. As the house gets older, what happens is the walls start getting a little bit more frail, and they get damaged maybe, and they might need replacing. So what happens is we have these little cells called osteoclasts, and they basically remove old bone. So they'll take a section of the bone and they'll remove it. Okay? Then what happens is we get the osteoblasts come along. Now what they do is they're like the mortar, you could say, and the bricks for the house. So they basically come and fill it back in, and hey presto, we have a new bone. And throughout our life, this will sort of continually go on, and generally every 10 years or so, the whole bone itself will have gone through this process. So you'll have a completely different bone, or newer bone, each 10 years. Up until a certain age, at which point sometimes you'll find that the osteoclasts are more active than the osteoblasts. Now, when that's the case, what you tend to find is that your bone starts to weigh a little bit. If we go back to the previous diagram, you tend to get more porous bone forming, because the bone's being cleared away, but there's not the osteoblasts to rebuild on top of it. So think of it like this. Imagine this is your bone. When you're a fully healthy adult, it's very strong, it's very rigid. There's no way that I'm going to break through that. Yeah, so pretty strong bone. So that's going to take all my weight. It's going to do whatever I need to do with it. Now imagine as you get a little bit older, or let's say you've got too many osteoclasts and not enough osteoblasts. I'm going to use a little bit of a Malteser to show you. So you can see inside the Malteser it's actually quite porous, and basically that means it's going to break really easily. So if I put a bit of pressure on that, I'm going to have to clean that up afterwards, but the bones will crumble. Yeah, so that's what we don't want. Obviously, as the bone starts to sort of degrade, we enter a process called osteoporosis, where the bones become really brittle, really good chance of them breaking, and obviously it's going to increase the risk of falls and things like that. So older adults in particular, as they do less exercise, hormones start to change a little bit, this process can happen there. Moving on from the bones then, so we've got different joint types. Now linking back with that, we've got different parts of the body that are connected different ways. So 3 different types of joint that we've got. So let's talk about the first one. We've got a fibrous joint. As it says in the description, it's immovable. So let's go back to the cranium. We've got one bone here, one bone there, one bone there, and they're all fused together, so there's absolutely no movement that can take place in that bone. Yeah? So it's given the skull as an example there. Now, a cartilaginous joint is slightly different because it's actually one bone, another bone, and then a little bit of cartilage in between that sort of connects them together. So the obvious example is the vertebrae. So I'm going to draw a very bad example, but if this is one of your vertebrae, we have the little disc in between, and then that connects on to another vertebrae. So that there is technically your cartilaginous joint. Yeah. So that little bit there is your cartilage attaching the top vertebrae onto the next one down, and we call that fibrocartilage. So on the previous couple of slides, we mentioned hyaline cartilage, which is on the end of a bone, which stops with friction. This one, the fibrocartilage, is a little bit different because this is actually a connective cartilage. So other than the vertebrae, there's a couple more which we'll talk a little bit more about as we get into the level 3 side of things. Synovial joints. Now, these are the main ones really. These are the sort of big boys. This is what basically produces all of our movement. As you can see, it's a freely movable joint. It's got a capsule. It's lined with a synovial membrane which produces synovial fluid. Synovial fluid, if you've not heard of it, is like the body's own version of WD-40. So what it does essentially is it lubricates the joint. So if we take the elbow for example, that movement, the synovial fluid, will allow for easy passage of bones past each other. So we're going to come on to them in a second. Maybe you've got a few ideas already in your head as to what synovial joints we have. I've kind of mentioned one already with the elbow. The next page basically goes into all the different types of synovial or freely movable joints. So the first one we've got here is the ball and socket. There's 2 different types of ball and socket. There's one in your shoulder and we've got one in the hip there. So naturally, very freely movable. Yeah, it can do pretty much any movement that you ask of it. A hinge joint, going back to the elbow, going back to the knee, very much works forwards and backwards. Yeah, if you think of a door, it opens, it closes. It's essentially what your elbow, what your knee would do as well. Pivot being next. So the example it's given you here is the atlas and axis. Now that's not going to mean much to it at the moment. Essentially, the atlas and axis is the top 2 vertebrae. They're slightly different from the rest. They sort of stand one on top of the other like so. And what they do is they rotate around each other like that. So the very top 2 vertebrae up in your neck, yeah, basically what helping rotate your neck around. So they sit on top of each other. There is another pivot joint in the body. Confusing, but in the elbow, your 2 lower, your forearm bones actually rotate around each other as well. So you could say that you have got a pivot sort of near the elbow, just underneath the elbow in your lower arm. Next one is the saddle joint. So imagine you're sat on a saddle, your thumb, so it's like a joystick. So it goes forwards, backwards, left, right. You can do sort of little bits of circles, but it sits in there as if you were sat on the saddle of a horse. Gliding joints, less familiar with most people. Basically, this is where if you think you've got 2 bones, they basically glide over each other, like so. Yep. So the example here is called the acromioclavicular joint. Now up in your shoulder here, you've got a little part, you can probably feel it, a little bony part on the top of your shoulder. That essentially is your acromioclavicular joint, or it's at the top of your shoulder blade, the acromion process. Now, if you was to sort of move your shoulder around, you'll feel it sliding a little bit over there, like so. So it's quite a good way to feel the joint moving itself. And what's happening is the clavicle and the shoulder blade are basically sliding over each other to allow the girdle, the shoulder girdle, to do these sort of movements. Yeah. So it allows our shoulder blades basically to move forwards and backwards. Last one, then we've got ellipsoid. So basically, it's a smaller version of a ball and socket. Basically, it's not got quite the same amount of movement. The example here is your knuckle, where your palm meets your fingers, basically, and it does very similar movements, but it doesn't allow for any rotations because it's not in a socket, you could say. So that one there, we've got the knuckles quite freely movable, as you can see. So all these here, there are major joints that we've got in the body. Now, linking to these joints, I want to talk a little bit more about the spine, because it's a bit of a complicated one really. It's got different joints as part of it. So here's a much better version of what I'd be able to draw of the spine. As you can see, it's broken up into 5 different sections. So the top section of the spine is called the cervical, or the cervical, however you want to pronounce it. And this one has 7 individual vertebrae, each connected, other than the top 2, via cartilage. The next section down, we've got the thoracic vertebrae. Now that's sort of like, behind your ribs essentially, so it's that upper section of your torso. And that one has 12 individual vertebrae. Yeah, so that one's going to help with all of that flexion of the spine, things like that. Next one down, this is the one where most people have issues with, it's the lumbar spine. Now, if you remember back to the diagram, there's a little gap between the ribs and where the pelvis starts, and that section there is all supported by the lumbar spine. And basically, that's the reason why a lot of people have issues, is because that's what's carrying lots and lots of weight. So you'll see from the diagram, they're much bigger than the rest of the spine, because they've got to deal with more stress, more pressure, more impact. A lot of people have spinal issues. It tends to happen at this point here for them reasons. Again, they're all connected via the cartilage. There are little discs in between. The bottom 2 sections though, very different, because these 2 sections are all fused together. So we've got the sacrum, or the sacral vertebrae, which has 5 individual, but now rather than the cartilage there, they're all connected and fused together, so there's no movement here. And that links onto the very bottom one. We've got the coccyx there, and the coccyx is like often referred to as the tailbone. 4 bones, all fused together. So the bottom 9, you could say, are all fused, and the top ones are all slightly movable. The very top 2, freely movable, so it's a little bit different. So the way I sort of remember it, usually, a lot of times you need to know the order of the sections of the spine. So you can think of, call the Liverpool Soccer Club on 712 554. Or however else you want to remember it, whatever makes it easier for you. That tends to be how I would go about it. Now, with the spine, we've got different sort of postures with the spine. So we see a lot of people walking around like this, maybe a bit lopsided. So we've got different abnormalities of the spine. So the next slide here, you can see a few different abnormalities. So let's talk through them very quickly. We'll start off on the left-hand side. We've got what we'll class as a neutral spine. So this is the exact sort of shape your spine should be. And as you can see, there should be 4 nice curvatures, not too excessive. Now, if you look to the next one then, we've got what's called lordosis. Lordosis, as you can see from the diagram, is where you've got an excessive curvature in the lower spine. So it's basically pushing your lower back in. Naturally, it's going to shift the centre of gravity forward. So if you've got lots of extra weight around here, that's probably going to what's causing that particular posture. So if you've got a lot of abdominal obesity, if you maybe pregnant ladies in particular, it's going to pull the spine forwards. It's going to put a lot of pressure on the lower back in particular, and it's going to create muscle imbalances as a result. Kyphosis, you probably see a lot of people walking around with what we call the hunchback sort of posture, whereby all the muscles on the front of the body here are dead tight, so they're pulling your shoulders round, and basically it's almost pushing you down towards the floor. I usually say, as you get older, gravity tends to pull you forwards, so you'll see little old ladies, as they get older and older and older, they tend to fall further to the floor, to the point where you see this sort of posture, generally because of gravity. So what needs to happen is these upper muscles in your back need to be strengthened to pull your shoulders back around, open up your chest, and try and alleviate some of that bend, that curve that you've got in your spine. Last one being scoliosis. As you can see from the diagram, it's where your spine's like an S. So this one can be caused through genetics. A lot of people are actually born with slight scoliosis. It's slightly off-centre, as you can see. It can be quite severe in some cases. Now, a lot of people can get it just through general sort of posture, through different training that they do, one-sided sports in particular, if you're a tennis player or a golf player, something like that, where it's all one-sided, that's going to affect muscle balances from the right side to the left side, and that could cause a shift in the spine as well a little bit. Generally sitting on a seat the same way all the time could cause it. Standing on one foot all the time, carrying a bag on the same shoulder all the time, things like that can actually create scoliosis, and again it's going to create postural issues, it's going to cause pain. Most of these you'll associate with some sort of pain. And other than that, that concludes our session generally on the skeletal system, so I hope it's helped. The next little bit is just to go through a few recap questions, see what you've learned from the session. So here you are, have a go at these 5 questions.